Welcome to Black Health Matters. I'm Daryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Yeah, it's interesting. The service members are saying no to COVID vaccine, along with other members of the people. It surprised me that the Navy sailors said yes, but the rest of the service population said no, which is surprising. Any of you military people? Apparently not.
My late husband was retired military.
Any thoughts about why the military would say no?
Well, let me do it another way. I think the Navy said yes because of submarine experience. So many of them and the carriers, enclosed containers, and there have been such outbreaks. The other branches are more outside functions. So I think that probably has something to do with it. Along with, I think that much of the military is now infused with, or more infused, more outwardly with more racist kinds of attitudes. And they see it as being something that impacts Black and brown people more. I think that really has something to do with it as well.
That excuse that's at the bottom of the screen that said the amazing one I heard was the Army always tells me what to do. They gave me a choice, so I said no.
Well, that too.
That's interesting. When people force you to do things all the time, then you exercise your power that you never
But
had.
that's also an outgrowth of the last administration as well. I think we're going to see a lot of that carryover still, with that attitude about people aren't going to tell me what to do.
Yeah, well,
I know someone who decided, ex-military, decided not to do it because in the military, this individual said he went in, was there for a while, went overseas, came back, and everything was based on shots. You get a shot for this, shot for that. He left the military. I don't hear something's going on. He left the military with being allergic to peanuts, allergic to fish.
Hello.
And swears his skin coloring became darker.
John
so he's
Tatum?
not going to get any more shots.
John Tatum, you need to
Yes,
mute
good morning.
yourself.
My name is
John?
Tatum. Hold on. Yeah, can you hear me all right?
yes, mute yourself.
Okay, hold on one second. Okay,
Mute yourself, John.
Well, come and mute me while I'm on the phone.
Okay.
Okay, I'm sorry.
Yeah. Well, that's interesting.
I'm on a Zoom call right now, and I gotta mute myself. So, can you hold 1 second?
Sure. Can you mute yourself, John?
Yeah, he's doing it now.
Okay. All right. Yeah. Well, it's an interesting perspective that the military says no because they can, but they have no option about the flu. So it's going to be short-lived. I think that it's going to be mandatory after a while in the military.
Yeah, I got a friend who's a dialysis patient. He's retired military, and he refuses to get the vaccine. They offered it to him early because he's on dialysis, but he refused it because he said when he was doing tours of duty like Operation Desert Storm, he says that they injected him with a lot of different chemicals that he thinks are responsible for his current health condition. So he doesn't trust any government-sponsored vaccination programs.
I see.
And that's what this ex-military person said. They gave me too many shots. I'm not taking it.
One other consideration, a lot of the enlisted men are pretty young. So maybe they feel like they're immune more so than the elderly.
Yeah, they are, but young people die too.
Mm-hmm.
Yeah, but that's true. They are less likely to die than the older people. But we have people of all ages who die from COVID. Okay, next slide, please. Now, this is an interesting article because there has been a reduction in the hospitalization and death rate, mostly all over the world, the United States as well. And is it coincidence or cause? And in Scotland, they think it's the COVID vaccine. But here again, the data is not adequate to really draw that conclusion. But this is the data they have. Of course, they have more of their population received the first dose. We are far down the list, something like, let's see, we had what, 5 million doses, and we have a population of 300 million. So yeah, we're pretty low. So we got a long way to go to get up to 20%. 20% of 300 million is what?
60 million.
Yeah, right. So we got a long, so we got a long way to go to get up to that one figure. Oh yeah, I think this is important because some people don't recognize that the second dose is more likely to be associated with side effects than the first dose. And this kind of goes into detail and also tells you what you should do after you get the second shot. And some people have no side effects at all. And then some people, many of the people, the larger percentage of people have side effects that are stronger the second time, whether it's only the pain in the shoulder or whether you have a headache or fatigue or GI effects like John had or what. So, but it is clear that the second shot is more likely to be associated with side effects, fever, and I had one of my transplant patients had a fever almost 2 weeks after the injection. So it varies a lot, and I think the longer you're on prednisone, it may have an impact upon it as well.
Dr. Callender, I heard, I don't know, it's a rumor that if you did have side effects from the second shot, that it was an indication that your immune system was functioning properly. Is that any veracity to that idea?
That's the hypothesis. I don't know that there's any data because we haven't done a lot of antibody tests, but a lot of people have hypothesized that, but I don't know that we have data for that. This is interesting too. Taking the shot before, there's no data for this either, but people say this, and so they recommend you not take the Tylenol or Motrin before the vaccination, but take it afterwards, even if it's 15, 20 minutes after the vaccine. The timing between doses does not need to be exact, and there's a lot of data that shows it can be up to 6 weeks after the first dose and still be very effective. Well, yeah, we don't, there again, we don't know about this because it hasn't been studied. Although I wouldn't recommend it. I think it's wise to take the same manufacturer second dose as the first, because we don't know the answer to this question. Now this next one, this is an interesting answer. It doesn't preclude you, but he suggests getting it in another arm, which is interesting. But there's no data that it means you should skip your second dose. You should temporarily avoid all other vaccine for a period of time. Yeah, 2 weeks before and after the second dose, right? Yeah, this is a question that was asked before, and it's thought to be 10 to 14 days after your second dose is when you have full immunity. Now, that brings up an issue about the transplant patients who are on steroids for long periods of time. It may take a little longer for them because they are on steroids and other such drugs, and they don't talk about that, but that's a matter of record. See, this is it. Do you still need to wear a mask? And I say yes, although they're not sure whether it's for you or for those people who you interact with, because it's not, because there hasn't been data that prove that you are not capable of transmitting the virus, even though you can't get it. And there's more data coming out now that says you don't need to wear a mask for yourself, but everybody agrees until we have herd immunity, everybody should wear a mask.
Yeah, Dr. Callender, I'm a blood donor, and I haven't donated in 4 months now because of COVID. I did go in once during the lockdown, but so I go tomorrow. Today would be 2 weeks after my second vaccination, but they said wait till the next day after the 2 weeks before I could donate. So that's their policy at the NIH.
Safe policy.
Mm-hmm.
Safe policy.
Dr.
Okay.
Callender,
Yes.
when can you hug your grandchildren then after the second dose?
2 weeks.
Oh, okay.
Yeah. Average new US, this is what we talked about before, that it's one of the things that has been noticed is since a lot of people have been vaccinated, the hospitalization rate and the death rate from the virus is dropped. And is that coincidence or cause? And I don't know that we know, because I think the time is not sufficient for us to have any kind of herd immunity. So I don't know what it'll turn out to be the reason for the decreased. Maybe more people are paying attention. Maybe more people are wearing masks. Maybe more people are social distancing. I don't know what the answer is. Neither does anybody else.
Yeah, I think it's the echo effect from the holidays. The holidays are over, so people aren't gathering like they used to during the holidays. That's just my opinion.
Well, it's I think many of the issues were addressed in the presentation. But in spite of all of this, the distrust will increase when they hear about the mortality that we talked about. And the issue of access that was talked about from beginning to end remains an issue that has been underserved. And I think the point that he made is that with the new variants, they become even more likely to get the virus than ever before. So it becomes even more important to get the vaccine. And many are recognizing finally that utilizing the faith-based community is one of the better ways to accomplish our mutually desired goal. Now, this is an interesting data for New York City because you can see that 12% of the people were blacks, even though 22% of the population is black. And I guess the figure for the country is only 5% of people who have been vaccinated are black, while we make up about 13 to 15%. So we are not, black people are not being vaccinated like they should be. And so we've got to get the message out and try to do things to positively reinforce this. This is a story that has gone national about a physician who felt that the way she was treated resulted in her death, and that this was typical of how black people are treated who have COVID. And this has happened to many people. She's one person, but it's happened to many people. And one of the things that some people don't realize, that the Latino Hispanic population is victimized with this disease even more than we are. So that you got 44% of the Latino Hispanic population have died. 44% of the population that has died are Latino Hispanic. 28% are African American. So they're twice as likely to die from it as we are. And we are twice as likely to die from it than white people are. So those are
she was from was she from Carmel, Indiana? I think I saw that from Carmel, Indiana.
Well, it said Indianapolis in the article, but that's the same thing as Carmel. Carmel's just a suburb of Indianapolis.
Mm-hmm.
Oh, but yeah, it does say Carmel.
Carmel.
Yeah. Even they'll say an affluent suburb of Carmel, Indiana, but I think Daryl can attest to that since we both were raised in Indiana. I don't know. What do you think, Daryl?
What about Carmel?
The racism,
Oh yeah, very definitely. It's still Indiana. Indiana is very much a racist state.
That's the birthplace of KKK, right?
Right.
Right.
I went to school there. I went to school in South Bend, Notre Dame. Yeah, I got that up there too. All right, let's move on.
Yeah. Now this is an interesting data that identifies that we don't need to quarantine, but that still doesn't mean that you don't need to wear a mask. But it goes back to the point of somebody asked when can you give your grandchild a hug? And you probably could do that after 2 weeks after you've had the second dose.
Oh, okay. You got to wait 2 whole weeks after you got your second vaccination?
I gave you that answer, Carol.
Oh, okay.
You didn't like it. You didn't like it, but that's still the answer. That's still the answer. Now, this brings up an issue that some people have brought up before. Should healthcare workers be required to be vaccinated? And that's a question that so far remains unanswered. It's going to be answered because I believe that by 2022, it's going to be required that health workers be vaccinated, just like they're required to be vaccinated for other illnesses. Hepatitis, you need vaccination for that. And actually you need vaccination for the flu. It's required. So I think COVID is going to join the list of those where your job is going to, if you work in hospitals, your job is going to require that you take this vaccine along with the other vaccines.
So what makes this vaccine so people are just railing against it? Why? when, you know, like in the medical profession, if you're going to be in the medical field, doctor, nurse, there are certain shots you just have to get or you can't practice, right?
That's correct. That's correct. Yeah, and you're asking me, why do some healthcare practitioners not want to take the vaccine? I don't know the answer to that, because I think it's just a basic fear of the unknown and the fear of the fact that the vaccine was done so early. And we've made it more pretty by saying it's lack of awareness. It's in some ways it's ignorance, but anyway.
Well, also, Dr. Callender, we're battling the negative press that's been put out by a bunch of ignorant people who, you know, like our former
Yeah.
president, you know, and you know, that in addition to the fact that it's a brand new technology, relatively, you know, for most people, so people are afraid of, you know, of that. I mean, messenger RNA. I mean, you know, you and I know about it. Daryl and you know, anybody who's in science knows about mRNA, but the average person doesn't. So that's why all those conspiracy theories got out there. Oh, they're implanting nanotechnology, you know, scanners in your blood, and they're going to change your DNA. I mean, there's all sorts of you know, bad information being put out by a lot of people, especially on social media, who are ignorant.
Yeah, that's true.
Sorry about that.
What is this chart showing us?
These
I
are
just showing the jobs that have the largest death increase during the pandemic.
Okay, so a cook is at the top of the list.
Well, no, yeah, that's what it says. That's what it says. Yeah.
But
this is California.
a chef and the head cook is toward the bottom. Why? Chefs and head cooks. But a cook is at the top. But if you're the head of it, you die less.
It's just like the administrators of the place. The cooks do the work. The chief chefs and the head cooks, they administrate to some extent. So it may be that may be one of the reasons.
And so to be a maid or a housekeeper, you die less
than the cooks.
That's in California.
Yeah.
Okay. So what implication does that have cooks for the general population? I mean, is there transmission from the kitchen to people who are consumers or what?
I don't know the answer to that. I was surprised to see cooks to be far ahead at the top of the list. So I don't know. Anybody who works in that industry? I know much about the industry as to why cooks are by far number one. I was surprised that healthcare providers were down at the bottom as well.
Dr. Callender, I'm sorry, I have an emergency about my brother. I'm going to have to leave.
Okay, we'll be praying for you.
Thank you. Only question I want to ask you is that he tested positive for coronavirus on the 12th. So they did the test on Monday, it came back positive, they said. So can he get his second dose on the 2nd of March?
Say again?
He tested positive for coronavirus on the 12th. And they repeated his test on this Monday and it came back positive.
Okay.
So can he still get his Moderna second dose on the 2nd of March?
Is he asymptomatic or symptomatic?
He's not symptomatic, no. He's doing fine, no temperature or anything.
No, well, you'd have to ask the doctor. I would think it'd be okay.
Okay, thank you very much. God bless you. I'm sorry.
That's my opinion though.
Yes, thank you very much. God bless you. Thank you, dear.
We'll be praying for you.
Thank you. Thank you. Bye-bye.
This is now that the vaccine has been delivered. Many of the clinics around the district are now receiving, are able to register for first and second doses. I know when one of my patients tried on Monday, the vaccine had not been delivered because of the weather. But I understand that since then, it has been delivered. So that people signing up for it now are more likely to be able to get vaccinated.
Dr. Callender, yesterday, one of my friends who got vaccinated at Howard, and she was complimenting it and had the same experience that we had, that they were cheerful, very people orientated, very helpful. The site, it was no waiting in line. It was just a perfect place to get your vaccination. So I concurred with her. It was just wonderful. And she just couldn't get over how wonderful Howard did with their vaccination site.
This is a picture of Howard right here.
Right.
That's the door I went in.
Mm-hmm.
Well, that's good to hear. Positive feedback. And this is now talking about the Black churches, and the only thing that I'm not recognizing is the fact that the Latino Hispanic population is twice as likely to die from COVID than we are. And I'm not seeing that aggressive Latino Hispanic push, which ought to be there. Sometimes people forget that Latino Hispanic are the #1 minority in this country.
My next door neighbor, who is white, got her shot at Howard as well.
Don't you live in Montgomery County?
No, I live in DC. I live in DC.
You live in DC. How that lady get all the way from your ward down to Howard?
Dr. Callender's is doctor.
But you see the other people in the pictures, they were from PG. Bowie and the other lady from PG as well.
Sure, why not?
Yeah.
Now this is for us.
Exactly.
We all know about the high fever, dry cough, and shortness of breath, but these are some other things that you might not. And I just had a friend of mine whose father just wouldn't wake up. More than sleepy, not eating, confusion, just failure to speak. And so the fact that the COVID virus affects the brain can be a problem as well.
Dr. Callender, tell me a little bit about 5 minutes of double vision. Where's that come from?
I don't know. There's so many causes of double vision. The worst thing to do is get you checked by your eye doctor.
Mm-hmm.
And hopefully that's the cause, because there are other causes that have to do with the brain. But the first thing is to get your eye checked to make sure that it's not a local eye problem. But after that, the CNS, the central nervous system and the brain is a concern.
Gotcha.
Now, this is the future, I think. As you know, anytime you have surgery, you have to have a negative COVID-19 test. Before any procedure at the hospital, you have to have a negative test. And soon, I suspect that people arriving in the United States are going to have to prove that they are negative or that they've been vaccinated. So that's the future. It's amazing how broad the COVID impact is on everything that you do.
Yeah, Dr. Callender, as a diver, you know, I'm faced with this issue as well. If before I travel, I have to get tested, I have to be negative. Before I can return, if I, you know, leave the country, I have to be tested 2 days or 3 days in advance of travel. And I have to be able to prove that. I mean, I've got my CDC card that shows I've got my vaccinations, but they want to make sure that even though I've got my vaccination, I have to take a test.
Yeah. Well, that's the way. What to say? The safest thing is to stay home. But times are changing. You know, so many. And I don't know how much this will change when most people are vaccinated. I don't know. It may not change at all, or it may change.
Even if you're going
Depends
in
what percentage of
between
the population.
states.
I'm sorry?
Even if you're going in between some states, like you're going from DC to California, which has that higher rate of COVID, you know, you may have to be tested before you can come back to DC.
Yeah, unless you've been vaccinated. You'd probably be okay if you've been vaccinated. But, you know, the question is, people who drive, nobody tests them, do they? So if you drive. So it's amazing how many ways and so many questions that are raised. It's interesting, the comment that Chaplain Boyd raised, if you are positive, because most people didn't have the results of the test, and you already had your first shot, should you go ahead and take the second shot? And, this is because the other part that isn't asked is should he or she be under quarantine? And the answer is yes. There's new information out suggesting that if you've had COVID, that 2 shots may or may not be necessary. They're not sure about whether the second shot is necessary because you already have antibodies. And the thought is that 1 shot may be enough, but that the data is not complete on that yet. Now, this is the AstraZeneca, which is 70% effective, which is pretty good. Now, I think one of the limitations on Johnson & Johnson is that they don't have as many doses of the vaccine as the others do, but then you only need one injection. It's amazing. You have 112 million who've already been infected, and 1.2 million or more have died already. And the United States only makes up 4% of the world's population, but accounts for 20% of the people who've died from COVID. So that we have the worst rate of infection and death in the world. And here we are, one of the most richest countries in the world, one of the most industrialized nations, and yet our healthcare system has exposed us to that because of our majority minority healthcare disparity and institutionalized racism. And number one, we don't have access. We don't have universal health care, which almost every other industrialized nation has. So that's one of the issues that has got to be addressed very soon.
Dr. Callender, we've previously talked about how racism is a disease. Well, now I've heard reports that racism is now a health problem, a community health problem.
Well, the public health has determined that it is one of the most important health issues of the day, and it's a crisis. And it's not something that's really new. It's something that they're now finally recognizing.
Exactly.
We've been aware of it for at least the last 25 years. And Margaret Helkla was in 1985, came out with the report that minority healthcare was a problem. And since that point, people have begun to recognize it little by little. It's kind of sad. And it's nice that Biden is now recognizing it and emphasizing the point of making it available to people, the point that Dr. Curry was pointing out. If you got it and it's not available, what good is it? So this is the issue that the opening of schools is another critical issue that remains, because Latino, Hispanics, and African Americans are more victimized by the lack of opening of school than any other ethnic groups.
I have a question about that, Dr. Callender. So teachers, shouldn't the teachers be required to be vaccinated before they go back to the classroom?
Yes.
But they haven't been able to effectively do that. And kids, I think
that's not true, because that's not true, because they have, in many counties, they have made exception and required that educators be vaccinated before they go to school.
Well, I think they should, but I don't think all of them have been vaccinated yet, though.
Some of them don't want to be vaccinated.
Right. DC opened up on Monday, back face to face.
Yeah. Well, I think it should be required that all teachers be vaccinated, but that's not the case, and I think it should be.
John, don't say face to face, say in person.
In person.
Yeah. It's the same. Okay, it's more attractive nowadays. Yeah.
You're muted, Carol.
You do know how the schools are opening up.
How is that?
The students are going 2 days, either Monday and Tuesday or Thursday and Friday. That means they can only see half the school for those 2 days. They got to stay in one classroom. The teachers have to travel. They still are going by their computers. They are still isolated. The problem is, how is this different than anything else? You know, they just well stay at home because they're almost acting like they're in, in jail already. They got to sit at that desk the whole time they're there.
Well, that's got to change. You're right, because
and they're at the computer. So what is different? They have more freedom at home. I guess they just get to another building, isolated.
Well, I think they see their friends. I think that has a lot to do with socialism.
Yeah.
But they can't touch them. You got to stay 6 feet from them, and they may be able to wave to them.
6 feet is still, you still see them and you still talk to them.
Yeah, at least it's not face to face.
This question about the mask is something that has been talking more about having it fit against your face and mask multiple layers. I think these are issues that become more important about our masks, because some people had masks that didn't have any of those things, just had cloth. And while we've seen studies to show that they're better than nothing, they're not ideal. I think the idea of N95 only being reserved for healthcare providers is kind of lost its way, because there's so many N95s that are available for everybody else. This is an article that talks about the, I guess we need to close soon. Talks about the fact that the Trump administration and the Fauci battle contributed to the huge death rate from COVID-19. 28 million cases and 500,000 fatalities. Now, keep in mind that 1918, which was the worst epidemic in recent years, in which 50 million people died across the world, only 675,000 people died in the United States, and we're getting close to that already. So this may turn out for the United States to be worse than the 1918 Spanish flu. And what it points out is the failure of our healthcare system. No other country is close.
Doesn't it also point out the failure of the leadership?
Well, that's the same thing. Yeah, both.
Mm-hmm.
Both.
I mean, because
the system and the leadership.
Yeah, I often think where would we be had the leadership done what it needed to have done early January of 2020?
I don't know, but I know it's a combination of both, because we also have a system that is discriminatory against minorities, and so when you have a racist regime that has white supremacy at its head, then the health system becomes part of the problem as well as its leadership. So the two go together. And but the answer to your question, we'll never know as to if we had a president who was more science oriented. But we do know that the healthcare system is very contributory to the problem. The fact that we don't have universal health care, and the fact that access is limited. Because I think that COVID just unmasked the unevenness of our system, which was intensified by our leadership. Okay, thank you. And Flavor's got to leave, and probably this should be the last slide for the day, because it's almost 11 o'clock. And how worried should we be about the variants? We should be worried that the transmission of it becomes more easy, and the vaccine is still protective, but so few of us have the vaccine right now that it's still a problem. And your question might be, while it's still a problem, still infectious, how come the hospitalization rates and the death rates are going down? And I don't know the answer to that question, but that's a question as well. Okay, we'll make this the last slide. So any other comments or questions?